Hello, today we are talking about the first signs of pregnancy. You are wondering, what are the signs of pregnancy? What shows in a woman who is just got pregnant, who has just got pregnant? What are the signs? What are the first signs of pregnancy? How can a woman tell that she is pregnant? Without further ado, let's begin off immediately. Sign number 1. They are tender, swollen breasts. Your breasts may provide one of the first symptoms of pregnancy as early as 2 weeks after conception. This is normally due to hormonal changes which take place, making your breasts to be tender, painful, or even sore. Your breasts may feel fuller and even heavier, so you should not really have any worries. Normally these are hormonal changes happening, and specifically you don't need to worry about it, but it's among the first signs of pregnancy. Next, fatigue and tiredness also ranks high among early symptoms of pregnancy. During early pregnancy, levels of the hormone progesterone increase. In high enough doses, progesterone can put you to sleep. At the same time, lower blood sugars, lower blood pressure, and even with increased blood production. This may team up to remove or to reduce your energy during pregnancy, and this explains why normally in the early days of pregnancy a woman may feel a bit weak. Next, slight bleeding or even cramping. Sometimes a small amount of spotting or vaginal bleeding is one of the first symptoms of pregnancy. This is also known as implantation bleeding. It happens when the fertilized egg attaches to the lining of the uterus about 10 to 14 days after fertilization. This type of bleeding is usually a bit earlier, spottier, and lighter in color than a normal period, and doesn't last as long. Some women also experience abdominal cramping early in pregnancy. These cramps are similar to menstrual cramps. So the next point we are looking at is there's always a slight bleeding, which is not so serious. So it's among the early signs of pregnancy. Next sign for pregnancy, we are looking at many women tend to get nausea, and some of them may get vomiting, some of them may not get vomiting. So when you get nausea with or without vomiting, then this is what we call morning sickness. This can strike at any time of the day or night and is one of the classic symptoms of pregnancy. For some women, the quashiness begins as early as 2 weeks after. Pregnant women also have a heightened sense of smell, so various smells tend to bring about the nausea and even the vomiting. Next, food aversions or cravings. When you are pregnant, you might find yourself turning your nose away from certain foods, such as coffee or fried foods. Food cravings are common too. Like most other symptoms of pregnancy, these food preferences can be increased or they can be brought about due to hormonal changes. So when you begin getting food cravings and even neglecting some other foods, these are hormones happening or bringing about this change. Next, headaches. Early in pregnancy, increased blood circulation caused by hormonal changes may trigger frequent mild headaches. Always when the headaches increase, please remember to visit or to go to your nearby health center and have your blood pressure checked, because also headaches could be actually indicating that blood pressure has risen or it has gone high. It has gone high or it has gone low. So the headaches themselves are not a problem, but if they don't respond to small simple painkillers, then you might need to go for a blood pressure checkup. Next point, constipation. Constipation is another common early symptom of pregnancy. This is brought about by an increase in progesterone. Progesterone causes food to pass more slowly through the intestines. This normally leads to constipation. Constipation can be managed by simple foods like taking plenty of water and also increasing the consumption of sweet bananas. Mood swings. The flood of hormones in your body in early pregnancy can make you unusually emotional and even sometimes cry. Mood swings also are common, especially in the first trimester. These are due to hormones flooding the whole system. And of course, faintness and dizziness. This is due to vasodilation or blood vessels dilating or increasing in size as the blood pressure drops. You may feel lightheaded or even dizzy early in pregnancy. Fainting may be triggered by low blood sugar. If this happens, please always make it a point to have yourself get checked in a nearby clinic. Raised basal body temperature. Your basal body temperature or your body temperature is your oral temperature when you first wake up in the morning. This temperature increases slightly after ovulation and remains at that level until your next period. If you've been charting your temperature, your body temperature, to determine when you ovulate, its continued elevation for more than 2 weeks may mean that you are pregnant. So increase in temperature, which is not coming down, could be a direct sign that you are pregnant. Missed periods. Perhaps the most obvious early symptom of pregnancy is when you miss your period. This possible sign of pregnancy is often what causes women to search for more details about the other pregnancy symptoms. So when you don't see your periods, then there are high chances that you could be pregnant. Some women tend to get a feeling of just being pregnant, so I would advise that please, if you begin getting the feeling, always confirm by doing a home urine test, that is the urine HCG test, and depending on the results, you may need to discuss this with your doctor, with your midwife, or even with your gynecologist. Thanks a lot for watching this video. Hope you've learned something from this video. Let me, if at all there's anything I've left or I've missed out, so that we can discuss it over in the comments down below. I will answer all your questions personally. Please ask me anything. Remember to like and subscribe to our channel. Gerard Massa, your health educator. Thanks a lot and have yourself a fantastic day. Thank you and bye-bye.